Hello everyone and welcome to our live lesson for today. My name is Bethan Edwards and I am the Academic Director here at Specialist Language Courses. And in today's live lesson, we are going to look at understanding the OET Speaking Assessment Criteria. Now, feel free to make notes or take screenshots as the lesson is going on, but please know that we are recording this session and you'll be able to find it on our social media platforms, and on our social media platforms you'll be able to find plenty of free OET tips, strategies and videos which are really great to help in your OET preparation in the lead up to test day. You'll be able to find the links for these in the chat box. We are doing free live lessons every week. So the next live lesson that's coming up is on Monday, and that will be focused on linking in OET writing. So you can register for free for this next live lesson with the link that will be put into the chat box for you now. Did you know that we are now doing 4 live lessons a week? So for anyone who is a member of Reach OETB or uses the Reach OETB course, you can now have access to 4 live lessons a week on the different topics on Reach OETB in the different papers. All right, so a little word about how we're going to use Zoom today. So we are going to use the chat box to complete tasks during the class. So please write your ideas and share your ideas with the other people in the class today. We use polls to ask specific questions. So when there is a poll, it will flash up on your screen. Choose your answer and then click submit. And then we also have the question and answer icon, which we will use at the end. So if you have a specific question, then put your question in here and we'll do our best to answer them at the end. So today we are going to look at an overview of the speaking assessment criteria. We'll discuss what each criteria means and how you can meet each of the criteria in your OET speaking. So we're going to start with a question. So I have a question for you. So I'd like to know, what do you already know about OET speaking assessment? So in the chat box, please write down any ideas that you have on how are you assessed? What are the assessors looking for when they are giving you grades? Great, so I can see ideas coming into the chat. Thank you very much. So we've got, yes, we've got 2 different groups of criteria, and these include grammar, vocabulary. Yes, what else does OET specifically include? Excellent, so we've got empathy, great, and your overall criteria and groups, you have clinical communication skills. So they're looking at your clinical communication skills. How do you demonstrate empathy? How do you address the patient's concerns? Great. So as you've rightly identified, there are 2 groups. There are the group of linguistic assessment criteria. So this is looking at language, specifically intelligibility, which is your pronunciation and how your pronunciation affects your communication with the patient, your fluency, the flow of your speech and your conversation, and if any hesitations or pauses affect the patient's understanding. Appropriateness of language, so are you using language and phrases that is appropriate for the person you're speaking to? And resources of grammar and expression. Now, the linguistic criteria are marked on a scale of 0 to 6. So for each of these criteria, you will get between 0 and 6. This is what the assessor uses. This is an example of the linguistic section of the assessment criteria. So this is what is available for you to look at, what your teachers look at, and also this is a version of what the assessors will look at. So it's good to be familiar with these different descriptors so you know what the assessors are looking for. And the other group of assessment criteria that have been mentioned are the clinical communication criteria. So this looks specifically at your ability to demonstrate relationship building with the patient, understanding the patient's perspective, providing structure, information gathering, so collecting information, and information giving. And each of these areas are marked on a scale of 0 to 3. Now, this is the descriptors that you can look at to familiarize yourself with what exactly the assessors are looking for. Now, you'll notice that there are 5 different areas, so A to E, and then each of these areas have been divided into subcategories. So this is how you can know how you can demonstrate relationship building. So relationship building is quite a large concept, and OET provide the breakdown of what this includes. So for example, in order to build a good relationship in an OET role play, you need to initiate the interaction, the conversation appropriately. You need to demonstrate an attentive and respectful attitude, and you should be non-judgmental, and you should also show empathy. So for each of the different criteria, you can see these sub-criteria that will help you to make sure that you are demonstrating each of the clinical communication criteria. On the right-hand side, you can see the marking scale. So you have got from 0, which is ineffective use. So this would be in the case where you're not demonstrating these criteria consistently, you're not able to show that you can build up a relationship. 1 is if you are doing this sometimes, but not very often. 2 is you're doing this perhaps quite a lot of the time during the conversation, but not consistently. And then 3, you're taking every opportunity that you have to demonstrate your ability within this criteria. So it's a good idea to be familiar with this and understand what each of the different criteria mean. And this is what we're going to focus on today. We're going to focus on the clinical communication criteria. Now, how can you use the criteria in your OET preparation? There's a lot of information, so it can be overwhelming to be thinking about the role card, the patient, and the assessment criteria. So in your preparation time before you sit the exam, it's good to understand how you can use the criteria to help you improve. So using the assessment criteria, look at the highest band score, so a 6 or a 3. Aim to fulfill the description, the full description, so each of those subcategories in each of the areas, and create a checklist. So look at the assessment criteria, the clinical communication criteria, and give yourself a checklist. So each time you do a role play, you can have a checklist. Have I initiated the conversation effectively? Have I asked about the patient's ideas, concerns, and expectations? And you can have a checklist. So each time you do this, you can check off those things that you've done during the role play. The idea is that this becomes automatic. So the more you do it, the more you use your checklist, and your checklist will evolve once you have mastered certain things and you can demonstrate them each time. So what does each criterion mean and how can you fulfill them? So we're going to take a look at this, and we're going to look at some useful phrases for each of the different criterion. So A, we have indicators of relationship building. So we need to initiate the interaction. So you need to introduce yourself clearly. Now, depending on the situation and the urgency of the role play, this may vary, but you should make sure that you have a plan for how to introduce yourself. You should show respect. You should show empathy throughout the role play. So let's have a think about how you can do that. So when you introduce yourself, you can greet the patient and tell them who you are. So this is a good way to start your role play and to initiate the conversation. Show respect. So showing respect, you can do this in a variety of ways. One way is using polite language. So instead of saying, I'm going to check your blood pressure, you could ask, would you mind if I check your blood pressure? And you need to show empathy. So I would like to hear your ideas, please, for those of you who have been doing your OET speaking preparation and who are working as healthcare professionals already. What phrases can you use to show empathy? Write your ideas in the chat box, please. So what phrases we've got for empathy? Okay, great. Okay, good. Okay, great. So we've got some good empathetic phrases here, showing that you can see the patient's feelings and you can understand what's happening. So we've got, I can understand, I know how you feel, I can understand how you feel. You can have, I can see that this must be difficult. Great. So we've got two of these criteria that we can put together. So we've got demonstrating an attentive attitude. So here you can use active listening. So saying, using phrases like, I see, okay, while the patient is talking. And then you've got your empathy phrases. For example, I know this won't be easy, but it's important that you consider reducing your smoking. We can replace this. I know it won't be easy. I understand it might be difficult. I can see that this may be difficult. All right. So make sure you have a variety of phrases for showing empathy and relationship building. So let's take a look at B. Now, B tends to be one of the areas that students struggle with quite a lot. So it's sometimes difficult to demonstrate that you're understanding the patient's perspective and that you're exploring it effectively. So in order to meet criteria B, you need to find out what's worrying the patient. So you need to elicit the patient's concerns, ideas, and expectations. So you need to ask the patient. And then you need to make sure that when you respond to your patient, you need to address these ideas and concerns that you've asked about. Now, this is quite an important criteria, and it's important to note that if you do not manage to ask about the patient's concerns, then it will be very difficult for you to relate your explanations to the patient's concerns. So it's really important that you have some phrases and some ideas on how you can elicit the patient's concerns, ideas, and expectations, and then how you can very clearly link your explanations back to those ideas and concerns. Now, one way to help you remember this is by using ICE. So some of you may be familiar with this acronym. So always remember ICE. In order to demonstrate B, you need to explore and ask about the patient's ideas, patient's concerns, and the patient's expectations. So perhaps in your checklist, when you create one, you can use the acronym ICE to help you remember. All right. So when we are incorporating and understanding the patient's perspective, we first need to establish the concerns of the patient. So again, in the chat box, please, I'd like you to share your ideas. What questions can you ask, or how can you find out about patient concerns? What can you put in the chat box for this? We want to find out about the patient's concerns to make sure that we're addressing them. Okay, great. Okay, great. So we've got some great phrases coming in. Could you tell me what's bothering you about this? What's worrying you most about this? How do you feel about? What specifically are you worried about? Excellent. Now, remember that when you are asking these concerns, you can start with an open question. So, for example, can you tell me what brings you here today? And then you can follow this up with a more specific question. Is there anything that's worrying you about that? Or what is it that's worrying you about that? So we often go from an open question to a more closed question, even when we're exploring ideas, concerns, and expectations. Now, remember that you need to pick up on the patient's verbal and non-verbal hints as well in order to meet criteria B. Remember that in OET, you are assessed on audio only. You're not assessed on your body language and your eye contact in OET. So you need to make sure that you verbalize any hints that you're picking up on. For example, we could say, I sense that you're nervous, or some phrases we've already seen before, which is, I can see that you might be feeling worried. So make sure that you pick up on any of those hints and you verbalize them. Then you can relate your advice back to what your patient has said. Therefore, you're fulfilling criteria B. All right, so let's take a look at criteria C. So criteria C is about providing structure. So this means that you need to demonstrate that you can organize the role play logically. You can use clear signposting and use linking phrases in explanations. So let's take a closer look at this. So in order to provide structure, you need to sequence the interview purposefully and logically. So think about the sequence of information you're giving. So you might give information about a medical condition or ask questions, then move on to an explanation of a procedure, followed by some advice on medication. So think about the overall flow of the conversation. Then you may need to signpost changes in topic. So you need to make sure that the patient is able to follow you, in which case you need to use language or phrases to signpost a change in the topic. For example, now we've talked about the reasons for asthma, let me show you, or let's move on to talk about. If you have a patient who's quite reluctant to move on, you can say, okay, we've talked about this, we can come back to it next time, let's move on. So remember, you need to move the conversation on, but you need to let the patient know where the conversation is going. You also need to make sure you use organizing techniques and explanations. So this, as well as structuring the whole interview, you need to structure explanations. And to do this, you can pause. Now you need to use active and effective pausing. So pause before you move on from one point to the next, use chunking and checking strategies, and also use linking phrases. For example, first, then, and in your explanations. All right, so let's take a look at information gathering. Now, information gathering, as we can see, we've got 5 sub-criteria here, so it is a big part of the assessment. In order to gather information, this is where you need to demonstrate your active listening, showing the patient that you're listening, not only through body language and eye contact. So phrases like, I see, okay, to show the patient that you're listening. You need to use open questions followed by closed questions. So we're using funneling questions, an open question to get information, and then follow this up with specific questions about specific details. Make sure that you avoid compound questions, and make sure that you ask questions to clarify statements which are vague. So let's take a closer look. So in order to make your explanations, in order to make sure that you are listening actively, you have pausing, listening noises, and also echoing and repetition. This is another strategy to help. Make sure you start with an open question when you're gathering information, and then ask clear, closed questions which are not compound. So for example, you could start with an open question. So, Mrs. Black, what can I do for you today? Followed by a few more open questions. Could you tell me a bit about your symptoms? Then when you listen to the patient, you can then follow this up with closed questions. When did this start? How long have you had this feeling, for example? With clear, closed questions, make sure you avoid compound questions. So a compound question is asking too many questions at once. So here you'd ask a question, have you ever had chest pain? Wait for the answer. What about breathing difficulties? Whereas if you ask a compound question, have you only had chest pain or any breathing difficulties? There's a lot of information for the patient here, and they may not be sure on how to answer you. So make sure you break up those questions. Now, in the information gathering, the two areas that tend to be more problematic for students or are more difficult to remember are these final two. So clarifying statements and then summarizing information. When you listen to a patient, you may need to clarify what they've said to make sure that you've understood correctly. So you can ask questions or repeat what the patient has said to check that you have the correct information or clarify anything which is unclear. So I'd like to hear from you in the chat box, please. Again, what question can you ask to clarify information? Write your ideas in the chat box. So how can we clarify? If your patient has given you some information and you want to clarify that you've understood, you can use some phrases. Okay, great. So you can use phrases like, what do you mean by? Could you repeat? I want to make sure I've understood correctly. Excellent. Okay, good. So we've got some phrases here. Can I just check I've understood? Do you mean? Could you explain what you mean, or could you tell me a bit more about? And for summarizing information, so this is quite a key part of information gathering, which is easy to miss out in your OET role plays. Now, remember, when you summarize, it's just that, it's a summary. You need to shorten what the patient said, not repeat back exactly their words to you. So you can use phrases like, so you have had the headaches for 3 days and no other symptoms, is that right? So what you're telling me is that right? So make sure you summarize in your own words. Now, our final criteria is information giving. So this is when you need to provide information for a patient, and you need to make sure you do this in a patient-centered way. So in order to do this, you need to find out what the patient knows already. You need to make sure that you chunk and check. So you're pausing. So making sure that your patient is following you and you're giving this information in manageable chunks so that they're able to understand you. Give them a chance to ask questions and also checking the patient has understood. So looking at this a bit more closely, you need to find out what the patient already knows. So when you're looking at this criteria, make sure you think about how you can demonstrate these skills and think of some example phrases. So for example, you might ask, what do you already know about? Do you know anything about? Have you read anything about a particular topic? Make sure that you ask the patient to contribute their feelings. So similar to ICE, we're asking about ideas, concerns, and expectations. Also, when we're giving information, we're asking them to contribute feelings. For example, how do you feel about that? And does that sound all right? Check whether the patient has understood. So remember to pause and check. Don't give too much information without pausing and checking. So you can use phrases just to check you've understood. Let me recap. And then don't forget to find out what the patient, what information the patient needs. So you may think that your explanation is very clear, but perhaps the patient has missed something or wants to know more. All right, so when you are preparing for your OET, you should familiarize yourself with the assessment criteria alongside the functional skills that you need to demonstrate. And for example, if we look at clear explanations, so you will need to explain information in your OET roleplay for whatever profession you're doing. And working on providing a clear explanation you can work on meeting more than one of the assessment criteria. So for example, to give a clear explanation, you need to find out what the patient already knows, use patient-friendly language, split the information into manageable chunks, use linkers or signposting language, a pause to allow the patient to respond, and elicit any patient concerns, and then confirm understanding. So with your explanation, if you are able to provide an explanation that meets all of these points on the checklist, you will do well in particularly areas C and E. So it's very important, this first stage, finding out what the patient already knows, as this will influence your explanation. For example, we have two ways to start an explanation. We can start with, could you tell me what you know about eczema? And your patient says, I've heard of it, but I don't know what it is. Or your patient says, yes, I know a bit. So asking this question, first of all, will help you to give an explanation that is relevant to your patient. If your patient doesn't know much, then you know that you need to give a lot of the full information about it, and you give the signal that you're going to explain. If your patient knows a little about it, then you can confirm what they know is correct and then go on to your explanation. For example, let me explain a little bit about what eczema is. Is that okay? Or, yes, that's right. Let me explain a little bit more. And then you explain the parts that they don't know already. Some common mistakes that we find with clear explanations. If you forget to ask the initial open question, you explain too much that the patient perhaps doesn't need to know. Not pausing after a chunk of information to allow them to ask questions and check understanding, and missing out on signposting. So it's confusing for the patient to follow what you're saying. So remember to use these phrases and avoid these common mistakes in order to give successful explanations. So our top tips for using the clinical communication criteria: make sure that you understand the descriptors and use those descriptors to make a checklist, practice the role plays regularly, and make sure you use your checklist and update it each time. All right, so we have a few moments for questions. So if you have some questions, please pop your questions into the question and answer section on Zoom, and we'll do our best to answer them today. So let us know if you've got questions about the speaking or about the clinical communication criteria today. All right, so any questions that you have, just pop them into the chat box or onto the Q&A icon. All right, so thank you very much for attending, everyone. It's been really great to have you here today. Don't forget to register for our next live lesson, which will be on Monday, and that is on linking in OET writing. Please follow us on our social media platforms in order to get updates on what we've got coming up and our next live lessons. So you can find the links in the chat box now. And for those of you who are getting ready for your OET exam, we've got a great range of courses. So we've got Reach OET B Nursing and Medicine course, which is has plenty of self-study and also vocabulary and language that you need for your exam. If you want some specific feedback on the OET writing correction, then we have our OET writing correction service, and we also have our practice tests. If you're coming up to your test day, then this is a great way for you to practice under timed conditions. Thank you very much, everyone. It's been lovely to have you, and we'll see you next time.